Welcome to the Vet Dental Show. I'm Brett Beckman, board certified veterinary dentist, and we bring this podcast to you every Wednesday as a veterinarian, as a technician, as a dentistry team to help you be even better at veterinary dentistry in your practice. We're sponsored and partnered today with the Veterinary Dental Practitioner Program. If you're interested in being among the best anywhere in general practice as a team in veterinary dentistry, I invite you to request an invitation. Let's go to ivdi.org/INV, like invitation, first three letters INV. So IVDI, International Veterinary Dentistry Institute, ivdi.org/INV, and we'll get you the information that you need.
In the case with a fistula post-op, how do you price the repair? We typically don't have that occur, but if you're doing extractions correctly and doing flaps correctly, this is going to be something that should not occur in practice. But if you're seeing a patient that maybe came from somewhere else, has a fistula, we price that on a case-by-case basis, depending on how big the defect is, estimated anesthesia time, so that we can get a good price. If it's a fistula post-extractions at your practice, that might be one of those procedures that you need to take care of as client relations, because fistulas should not occur post-extraction when they're done correctly. If we are setting up an appointment for a dental, how do we say what grade it is? In the practice I work for, we say it's grade 2, then we kind of know what time space. Yeah, unfortunately, this is flawed. We don't know what grade they are until we see the x-rays. And so this is why we recommend no more than 3 patients in a day. And we want to kind of vet those patients, maybe a large breed, younger dog. We don't want to schedule 3 12-year-old Yorkies that haven't had a prophy in 2 or 3 years on the same day. So we've got to kind of educate our front staff or whoever is scheduling to recognize and kind of pre-vet those patients before scheduling. So you may want to apply a number to those patients in different categories to kind of help scheduling. An older small breed dog is going to be in a category that most likely is going to take more time. A younger small breed or a larger breed dog going to take less time. So stick with that number 3 amount of patients in a day. Once you become proficient and efficient in your dental department, you may be able to add a patient to the day once you're finding that you're meeting these goals, your x-ray full mouth series, getting that initial induction to treatment plan into that 15-minute window, hitting those kinds of goals. Oral surgery is what it is. It's going to take time. There's no way to speed that up unless the doctor is practicing on cadavers and doing oral surgery on a regular basis. That will eventually get there. But as a technician, we can certainly move up our portion of the procedure and get those times down and be much more efficient with patient turnover, which is going to be in our next session. And so we want to gauge these patients appropriately and schedule appropriately based on the patient. And we're still kind of guessing because we don't know, but we can categorize patients to give us a little bit better idea of what that schedule should look like. All right, question from Leah. Do you recommend all advanced oral diseases be referred to a specialty practice? It really depends on what your veterinarian is comfortable with. We do a lot of advanced periodontal cases because it's not really about the extractions. When there's significant bone loss, infection in the bone, infected tissue, the majority of those cases is debridement of bone, debridement of infected tissue, and then closure. And that's all advanced oral surgery, creating flaps, using healthy tissue where, if we're debriding a lot, sometimes that can be a challenge to get some of those quadrants closed. But that's what a skilled oral surgeon is trained to do. And if your veterinarian has had training from an oral surgeon, is comfortable doing oral surgery at that level, doesn't necessarily need a referral. But if not, then absolutely. So it really depends on what your practice, what your veterinarians are comfortable with as far as their skill level goes. Good question. All right, lots of questions regarding treatment plan. And we'll get through as much of these as we can. From Peggy, does vestibular bone expansion in cats always result in extraction? Good question. And the answer to that is no. And again, that's based on our diagnosis and what the x-rays look like. So in this particular patient, this is pretty advanced. You can see where we've got a lot of that bone that's expanded, a lot of bone loss on the canine tooth itself. And so this particular one would definitely be an extraction. That's pretty advanced, and you can see pretty obviously we've got a lot of bone loss around that canine. In this next slide, this is a much earlier change. The majority of that tooth has really healthy bone around it, following that periodontal ligament space all the way around that tooth. And we can see where we've got bone expansion at that yellow arrow just starting. And so this would be a case where you might want to refer for a boarded dentist to treat this particular area. And if you're not sure, certainly referral to have evaluated and treated, or extraction if that's what was deemed necessary. But in this case, we're able to just remove that infected bone, reposition the gingival flap so it's covered, and then we'll reevaluate this kitty cat down the road, probably 4 or 5 months, to re-x-ray and make sure that we're still going in the right direction. So it really depends, again, on what that x-ray looks like, how advanced the bone loss is before we make treatment decisions. And these can be challenging in some cases, especially if you're new to dental x-ray, new to periodontal disease, seeing it radiographically. And so there's absolutely no shame in talking to the client and saying we're seeing some changes. This tooth may be able to be saved, and I think a referral to a boarded veterinary dentist would benefit this cat and goes beyond what we're able to do. It's just like our teeth. Whenever I talk to clients, I try and relate our own personal experiences. And so, whenever we talk about dentistry, if you have a dental issue, would you go to your physician, your general practice physician, or would you go to a dentist or an oral surgeon? And absolutely the question is always, or the answer is always, a dentist or an oral surgeon. And so there's no reason to feel inadequate or like you're not doing your job. Your job is to assess, identify, treat what you can, what your skill level allows you to, and then refer. That's what we're here for. Just like orthopedics, cardiology, all of those referral services that no one thinks twice about sending a patient off, that's outside my wheelhouse. I'm going to send you to a specialist. Dentistry is exactly the same way. We're now finding that there's things that can be done to treat teeth rather than, clean them if they're dirty, pull them if they're loose. We've got to go beyond that. And our veterinary dentists help with that. You can certainly get there if you want to, increase your education and be able to handle those periodontal cases. But we're certainly there for you to refer. All right. Nerve blocks. Do we recommend doing that just before performing the root planing? Is there any chance of damaging anything doing a root plane? And what is the purpose of root planing? All good questions. The nerve block typically goes on right after I take my x-rays. I am evaluating and looking at each quadrant as I'm taking, or each view as I'm taking the x-rays, looking for any obvious pathology. I'm kind of storing that in my brain. Once I'm done taking those x-rays, I know which quadrants I need to block, and I'm going to put that on board as soon as I know. That way it has plenty of time to take effect, and that just takes a few seconds before I start the gross pathology evaluation, and then I have Dr. Beckman come in and take a look at the x-rays. Is there any chance of damaging anything during the root planing? There really isn't. The goal here is to use the correct instrument, which is the curette, and use it correctly in that pocket. It takes a little bit of practice, and certainly maybe a little bit of hands-on training, but you really can't. It's all soft tissue when we're doing closed root planing, which is in the technician's wheelhouse. Open root planing is a surgical procedure. We'll talk about that a little bit later in this Q&A. But it's primarily soft tissue, and you can't really damage anything. We're primarily getting all that granulation tissue out of that pocket, and so we'll show this video here, and you'll be able to see that.
This is the technique that we use to do closed root planing and subgingival curettage. Notice we took a look at that instrument to make sure that we were using the cutting edge against the tooth root while we're getting that granulation tissue out and any disease cementum or calculus against that tooth root. And we're going to turn that over, use that same cutting edge, and we're just going to scrape the lining and the base of that pocket using that curette in order to remove the granulation tissue that, if left, will allow progression eventually to the bone, and we'll get our characteristic bone loss. So once we're done with that, all we need to do is clean the pocket out, as you see.
All right. Is there a certain depth to a pocket in which you would recommend extracting the tooth? And again, periodontal pocketing is all soft tissue. What dictates extractions is bone loss. And so there are varying degrees of bone loss, and those are categorized within the periodontal parameters. Typically it goes to 0 to 25%. So it goes with the bone loss and how much bone loss is there. And so we want to make sure that we're evaluating radiographically so that we are not missing anything and base that on the bone loss.
I hope you enjoyed that episode. If you'd like more information about the Veterinary Dental Practitioners Program, please submit to request an invitation at ivdi.org/INV.